whatever you want. You're the city manager.
Little correction on the intro. Thanks for trying to make me look a little younger than I am, but I actually have been managing cities for over 30 years. Anybody from Michigan here? Yeah, I started in Warren, Michigan, Michigan's third largest city, way back in '81. But when I came here about 2 3/4 years ago for my first job interview, I did a little bit of research, and then when my wife and I actually hit the ground and we walked around this beautiful city, we went to Five Points Park, and you know, just a nice coffee shop in the neighborhood. We thought we'd just sit down and enjoy the ambiance and the beauty. And as you know, there are no benches at Five Points Park. And the commission had to remove those benches just a little while before we got here. And that's just, I think, an example of how homelessness, especially the chronic homeless challenge and the street people, as I referred to them as in the past, has really affected public policy and our quality of life here in the city. Nice to see all you, because I live downtown too. And I have a wonderful little big Labradoodle, and I walk him 3 times a day, and I see what's going on every day, and I know a lot of these people. But we're going to have some time. We're going to get into some hopefully fun, interesting conversation here. But I think it's really important that we all kind of start with a basic foundation and understanding, because there's been a lot of finger pointing, a lot of anxiety, a lot of frustration, understandably so. But nobody in this room, nobody in city government, nobody in county government created the situation that exists now in our country. You referred to, Peter, to folks suffering from mental handicaps. It's been 40 or 50 years now that this country has been on a tear of shutting down mental health beds. Good intentions, I mean, maybe the mental health hospitals didn't do the best job they could have done with the mentally handicapped. President Kennedy's own sister, I think, was mistreated at a mental health hospital. And of course, then we saw one flew over the cuckoo's nest, and Jack Nicholson had his day in the mental health hospital. But we've closed 400,000 to 500,000 mental health beds over the last 50 years as our population in this country has continued to grow. Unfortunately, the promised, I mean, another good intention program, but the follow-up wasn't so good. The system has not been backfilled with dollars or caseworkers or temporary facilities or even a strategy to deal with the numbers and volumes that we've got to deal with. So guess how many people are homeless in the streets of America today? Chronically homeless, living on the streets. It's a little more than 400,000, it's 600,000, okay? And they tend to gather in our coastal communities and the nice places to be in our urban areas. And it's certainly true here on the Gulf Coast. We have one of the highest percentages of homelessness in the country, not just Sarasota, but the Gulf Coast, and other communities in Florida obviously are dealing with the same challenge. And there's a couple other small complicating factors that we're all very well aware of. I mean, the family is evolved. I don't know where your children and grandchildren live or your relatives, but my kids are all over the country. Those family networks, those just aren't in place like they were 40, 50 years ago to help out and support some of these folks that need some help and support. And then we've had the globalization of our economy, and being from Michigan, of course, and probably a lot of you in your towns, those manufacturing jobs were there. They were good, reliable, middle-class jobs. We've lost a lot of those jobs, so these have all been little contributors to the scene today. But with that said, I mean, what are we going to do about it? But the understanding is important. And we, as a city, I think we should take some pride in the fact that, you know, we've tried to elevate the consciousness of this issue. We were the ones, I think, that initiated Dr. Margaret's engagement here. And thankfully, others contributed to that, including our friends at the county. And the good news in all of that was there were 12 recommendations. The better news that most of those recommendations are being worked on. A lot of the support went initially where it probably should have went to help families and children. I don't want to refer to it as low-hanging fruit, but you referred to the chronic challenges being still out there. And it really is out there. So we had a very fundamental, important, strategic disagreement with one of Dr. Marbut's recommendations, and maybe we'll talk more about that in a little while. I don't want to spend a lot of time on it right now, but I'd love to talk about it because it maybe still need to be a part of the solution. But anyway, we've let the Marbut program come through, and it's now been some months since he's left. We're kind of exhaling, letting the report and the information that we learned through that process sort of settle in and be absorbed. And we've also been working our tails off in the street. Even before Dr. Marbut recommended it, Chief DePino and others began to think about getting more engaged with the people on the streets. In case anybody doesn't know this, you should know that the Salvation Army had a shelter here as early as, I mean, you were in business here in the 90s. And it was 2003 when that 40-bed shelter was permitted to grow in the city to 250 beds, or something like that. And in 1998, the problem was apparently visual or visible enough and of a magnitude enough that our faith community organized and opened the Resurrection House, which remains open on Kumquat. And I just get so frustrated when people make the comment or even the illusion that the city of Sarasota has been mean-spirited and hard on the homeless. We had the Resurrection House, we had the Salvation Army, and we were the only community that has permitted a shelter. As of late, there's a new one in the unincorporated area in North Sarasota. But when the Salvation Army went to Venice to apply for their permit, they were prohibited from opening a shelter. So this community has been generous in opening its permitting process and its arms and its pocketbooks to support what is basically almost, certainly clearly an unfunded challenge. But the numbers have continued to grow, and the situation has overwhelmed our infrastructure, overwhelmed our resources and our ability to deal with it. So we have to figure out what to do next. And the City Commission has directed me as their manager and our staff to prepare for them a next step strategy. And we might get into previewing a little bit of that tonight, but that report will be presented within the next 30 days. It will include many of the things that have been mentioned, have been discussed, many of the things that we've learned, and I think we're going to be able to do much better when we're really coordinate on some things that are going to work, that have worked around the country. And I'm confident of that because when you come in as a new city manager, you try to assess quickly what the skills or the history of a community have been. And when you look around this community, I mean, I haven't seen anything like it. When you look at places like the Gloucester Schoenbaum Human Services Campus, when you look like the Friendship Center with how far ahead of the curve they have been with senior citizen issues, when you look at the wonderful things that have happened at Moat Marine and Save Our Seabirds and all of our cultural institutions and Children First and First Step, this community has just stepped up in a big way, time after time after time. And we're going to have to do it once more because it's a model we're creating to try to solve the problem. The federal government has withdrawn. The state government has, out of 50 states in the country, I believe we're 49th out of 50 in terms of how tax dollars flow. One last point, then we'll let the chief tell about what's going on for real on the streets. The way government is organized, in most parts of the country, health departments are in charge of mental and physical public health issues. That social safety net is very, very frayed. That mental health safety net is frayed. And I'm not suggesting everybody on the streets has a mental health problem, but we believe it's a high percentage of people are struggling. And that's the responsibility of our county government. It's just a legal, flat-out authority responsibility. they too are underfunded. So I'm not trying to point any fingers, but we've got to get this conversation organized into pieces and areas of who's in charge of what, who can do what, and how we're going to impact this situation. And the last thing I'll give you some information on is the cost of what we're doing now. One of our commissioners said, let's cost out the current approach. And the current approach is just kind of, moving people around, using law enforcement when laws are violated. The cost of what we're doing now to the residents of Sarasota County is, I think, conservatively $10 million a year. When you just add jail time, EMS runs, uninsured hospital emergency rooms, visits, and just some miscellaneous costs, and I think that's probably conservative. So if we use a recent point in time survey and just round off and say there are probably 1,000 chronically homeless people living in the streets of Sarasota, living in Sarasota County, okay? And if you do the math, that's about $10,000 per chronically homeless person per year, a lot of money. And some of these folks, as you will probably mention, have been living on the streets for years and years and years. And some don't bother us, others are habitually revolving through the jail and are very, very expensive. So on that bright note, I'll turn it over to the chief.